So what are we going to do? Well, I think a good environmental history is useful, and it's always amazing. The truth is, it's very hard for me to take a good environmental history because the time it takes is hard, but I'm going to have a questionnaire that people who want to do that can do and work on themselves. And you want to assess the toxic load of the individual through an assessment from qualified laboratories. And it's important to continue to follow up with not only laboratory testing, but a good clinical assessment. Next. The testing that you can do for petrochemicals and pesticides include a kind of a general test called a urine organic acid test. That's, I think, about a $275 test. The environmental pollutants assay, which is, I think, about a $100 test. This one is useful because it looks for the phthalates and parabens, which are the plasticizers. This is probably the best test, but it's expensive. I think each one's about $250. But you can look for pesticides, volatile solvents, and PCBs. The two most important, to my mind, would be pesticides and volatile solvents. And particularly in people with peripheral neuropathy, the pesticides are important. The heavy metal challenge test is easy to do and safe, and helps us get a baseline, and then what is in the tissue after we do a challenge with chelating agents. Neurotoxins are a more obscure issue that are, I would say, more heavily debated, but they could be the residues from chronic infections like Lyme or chronic mold exposure, and it's a simple test that we don't even charge for to look for. The general lab tests are things that we do often, but we look for at the red and white count in the blood chemistry panel. The homocysteine is a way to look for the efficiency of methylation, and optimal levels would be 7 or less. Methylmalonic acid is a way to look for 12. Microalbumin in the urine is a very interesting way of just looking at the health of the endothelium, the lining of the blood vessels. And GGT I underlined in red, although I guess it didn't come out so well. You know, it's a test that I think is no more than a $25 blood test. But the interesting thing about GGT, or gamma-glutamyl transpeptidase, is an enzyme that helps to increase the amount of a very important intracellular antioxidant called glutathione. And so we used to think it was just elevated if there was liver disease. But in fact, glutathione is important in all the cells of the body to reduce oxidative stress. So when there is oxidative stress from toxic burden or other factors, in younger people, and here's the catch, in people who have good health and are youthful, GGT will be elevated if the normal range is 10 to 80. Values above 40 are significant and speak to the fact that there is, you know, a potential of a toxic burden that bears looking at. But when we get older, and most of us over 60 are there, our systems aren't as efficient in this phase 2 detoxification, and you can't trust the GGT as much. So that sort of lets some air out of my balloon, because a lot of my patients are older. But because I was looking for a cheap way of identifying in whom we might justify looking harder. But in older people, I don't think you can absolutely trust it, or people who are chronically ill. Just the background enzyme systems have been so compromised. I think you have to go more by symptoms. Next. And then the therapies, you know, avoidance, mitigation, and supporting the organism's natural detoxification process. Some of the things that we've classically used over time that are in multivitamins and have some value are listed here. And they can be applied to different people who have different needs. And I do think that can simply be individualized, but the whey protein is a simple thing to put in a smoothie that for most of us will have significant value. Next. With neurotoxin remediation, any wall in the home or ceiling that's had dampness can be a source of molds. You can use prescription medications such as cholestyramine or Welcol, and supplements like chlorella or pectin or plant stanols. And binding agents are very good, like psyllium husk or rice bran. So if we have a Yerba Primus psyllium husk product that's very good, and then there's a product from Gaia Herbs that's a binding product that you take before each meal that has rice bran and some metamucil in it. And I think that those things work because it prevents the enterohepatic circulation. So if your liver excretes it, it helps minimize the chance that your distal bowel will reabsorb it. Next. For the petrochemicals, there are different products that seem to be beneficial. Obviously, the most important thing is avoidance. And so for each group that you identify, there might be different strategies that you would consider for avoidance. One of the most important things with the phthalates and parabens and other plasticizers, particularly for women, but also for men, are the bathroom products and the makeups that we apply. Next. And with the heavy metals mitigation, if people have a mercury burden, removing the amalgams and replacing with non-metal amalgams is valuable. Again, the binding agents, I'm sort of disenchanted with these things and really just using the psyllium husk and the rice bran products. With lead, you can use intravenous EDTA. With cadmium, oral EDTA. With aluminum, which I don't really think is as significant as we used to think. Malic acid chelates next. And then the general therapies have to do with adequate hydration, alkalination when appropriate, and a lot of it comes from your diet. In a subgroup of people who are very, very acidic, I will often use alkalinized water. The neural therapy is helpful, far infrared sauna, steam baths, supplements that support innate detoxification. When deficient would include selenium and zinc, but not when you have enough in your serum. What's the point of taking more if you have enough? But so, again, we individualize these things. Next. The biggest thing, I think, is not to go too fast. Because I think when people rush to get everything out, they really mess themselves up. So I often think the slower we do this, the better. That in general, unless you're very acutely ill, there's absolutely no rush on getting everything out. Because if you really push it, again, you can overwhelm the body with materials that you adapt it to through appropriate storage, etc.